hat I wear with the Breastfeeding Resource Center is I manage the breastfeeding hotline, and then we do a lot of obviously trainings and kind of outreach work, anything that pertains to education regarding lactation and breastfeeding. So, okay. Get in my screen here. There we go. So just some disclosures. We do not have any financial interest or arrangements or affiliation with any pump companies. I'll talk about different breast pumps or any other organizations. So I do not get paid by outside vendors or anything for like that for this presentation. And then we do try to be inclusive with all of our language. Obviously, in this kind of world, if you will, it is very common for us to use the word mother or pregnant woman. So we know that that's not always the case. And so we do want to be inclusive. So I'll, say breastfeeding families or breastfeeding parent, but every once in a while, mother may come across in some of the things that I say. But there is lots of resources out there for any and all parents. So just kind of want to touch on that. Okay, so these are our objectives for today. So just want to kind of go over the importance of breastfeeding, cover cover the laws that protect us regarding breastfeeding and pumping while you're at work or school. And then 3 different resources for breastfeeding support throughout Oklahoma. And then just kind of ways to navigate, okay, I've had this baby, I'm back at work. What do I do? Kind of, how to get a plan for what your work environment is for pumping and going back to work. Okay, so this is our staff. So we are a small but mighty team. So Becky Mantle is our director, and she's been with the OU system for many years. She managed the lactation clinic or the lactation service in the hospital. She helped start the milk bank, if you're familiar with that, and we'll talk about that more in a minute. She also started the hotline, and then of course the Breastfeeding Resource Center, and she of course still is very active. She's also serves on the Coalition for Breastfeeding Advocates for Oklahoma. And we'll talk about that more in a minute as well. There's myself, and then there is Amanda Parsons, and she is our outpatient lactation consultant with the OU physicians. So if any of you happen to have a OBGYN in the OU physicians building on the 3rd floor, that is where her office is as well. So just kind of a little note there. And then Sarah Bellotti, she is our any and everything. She does all of our coordinating. She's our finance administrator as well. So if you ever have questions about education offerings that we have or anything like that, she's our go-to person. Okay, so this is our website, just our homepage. I really recommend checking this out in your free time or after we get done today. There are so many resources on there. I use it all the time in the work that I do, and it's our own website. I tell families there's just anything that you need to know, like basic knowledge about infant feeding cues, or how do I become a lactation consultant, or information about the hotline, or the lactation resource guide for the entire state of Oklahoma. All of that stuff is going to be on our website. Thank you. So it's in the chat there. So definitely, kind of spend some time browsing around there. Okay, so how long to breastfeed? Wonderful news is that all of these organizations, the American Academy of Pediatrics, Center for Disease Control, and the World Health Organization all have the same recommendation, which is exclusive breastfeeding for the first 6 months, continue to breastfeed while adding age-appropriate foods around 6 months, each baby's different, and then continued breastfeeding for 2 years or as long as desired by the mother and child. It used to be exclusive for up to 6 months and then continued into a year. However, the world average is to breastfeed for the first 2 years of life. As in many of you may know, that is not the case in the United States. So it's really encouraging to see that finally all 3 of these came together and they said, okay, or more, it was the Academy of Pediatrics matched their recommendations with what the World Health Organization recommendation has been for a very long time. Okay. So why is breastfeeding important? Why are we here today, right? Why do we always hear, oh, breast is best, or you need to breastfeed your baby? So these are just a few of the impacts as to why it's important for the child. So when we don't have breastfeeding in the picture, Infants can have a higher risk of all of these different things. Obesity, diabetes, both type 1 and type 2, asthma, GI infections, more severe inflammatory bowel diseases such as Crohn's or ulcerative colitis, respiratory or ear infections, childhood cancers, obviously hospitalization, and then sudden infant death syndrome. So there is a link with reduced cases of SIDS with breastfeeding. So it's when a child is breastfed, they don't enter into that super deep sleep. They stay in more of an active sleep at nighttime. And that is what helps protect them from SIDS. Versus when they're formula fed, they may enter into that deeper sleep more often, or they may enter into it and then, sudden infant death syndrome happens. Okay. Why it's important for the preterm baby. Did I cover the mother? Sorry, I had another slide there. Sorry. So if a family ends up having a baby who is born premature and happens to be in the NICU, breast milk is even more important for those populations, obviously, because the baby needs a little bit of extra to grow and to continue growing that they would have gotten obviously in the womb. So in that population, the breast milk or donor milk, if the mother's unable to provide her milk, it helps all of this thing. So less instances of necrotising and endoculitis, which is basically where parts of the bowel die. Horrible thing. It's luckily not that common, but it is a risk in preterm infants. Suboptimal brain development, sepsis, the retinopathy of prematurity, so it affects the eyes. So that's what Stevie Wonder had. That's why he was blind. SIDS again, a longer stay in the NICU, and then hospital readmitting. So we really try to encourage those families that have a NICU baby to try to pump or provide breast milk for those babies. So the impact is dose related. So what that means is that even if they get one dose of breast milk, that's better than not getting any breast milk at all. And then the more breast milk that they receive, then the less risk they have for all of these things. Okay. This is for the mother. So we always hear about why breastfeeding is so good for the baby, but there are two people in that relationship, right? There's the breastfeeding baby and the breastfeeding parent. So these are some of the things that breastfeeding can help reduce health risks in the mother. So breast cancer and ovarian cancer, and that is linked to the hormones. So obviously there's lots of hormones during pregnancy and postpartum, but whenever the body goes through the full cycle of birth and then breastfeeding, it helps regulate those hormones, which in turn helps reduce the risk of developing breast or ovarian cancer later in life. And the longer that a woman has breastfed, the less chance she has. So say she had 3 children, breastfed each child for 1 year, then she has 3 years of breastfeeding in her lifetime. So that is going to reduce her overall risk versus someone who didn't do that for breast or ovarian cancer. Same thing, endometrial cancer reduces that risk. Diabetes, it helps prevent type 2 diabetes. Again, kind of goes into those hormones, helps kind of regulate them. Same thing with postpartum depression. Also cardiovascular disease, rheumatoid arthritis, metabolic syndrome, anemia, short birth intervals. So if you are exclusively breastfeeding, your period is delayed, you don't have ovulation, and so you have that natural form of birth control, and then you don't have those back-to-back pregnancies, which can be high risk dependent upon your health. Postpartum weight retention, so you do tend to return to your pre-pregnancy weight a little bit easier when you're breastfeeding. And then child abuse and neglect. So there's less child abuse and neglect with breastfeeding families. Okay, so reasons why families have stopped breastfeeding earlier than they desired. So this was a study, it's kind of old, it's 10 years old, done in 2013, and they looked at why these families didn't reach their own breastfeeding goals. And what they found is that 60% of the mothers who stopped breastfeeding, they did it earlier than what their own goal was. And they were like, well, why? What is happening? And these were the top reasons. So difficulties with lactation, infant nutrition or weight. So maybe the baby wasn't gaining weight and a doctor told them to supplement with formula or to stop breastfeeding. Maybe they had to take a medication and they got some wrong advice and they stopped breastfeeding. And then just the effort of pumping while they were away from their baby. Okay. So breastfeeding during an illness, we get this question on the hotline a lot. Can I breastfeed if I have the flu? heaven forbid I have COVID-19. Can I breastfeed if I'm taking Benadryl? All of the answers are yes. What's fascinating with the human body is that whenever either the mother is sick or the baby is sick, the breast milk will start creating antibodies to fight off whatever the illness is and help further protect the baby from either the illness that the mother has or to help the baby get over the illness that they have. So it's almost more important to breastfeed during times of illness versus to not. So this kind of talks about that. And we do get this call a lot on the hotline. You know, especially during the pandemic, we got this call a lot, which brings me to my next slide. So breastfeeding and COVID-19 in the very, very beginning, like almost exactly 3 years ago this month, we didn't know what to do right with anything. And there were some awful reports of women being separated from their babies for like 2 or 3 weeks after birth because the mother had COVID. They didn't know what to do. They didn't want the baby near the mother. But what they have found, luckily in a short time frame, is that it does not put the baby necessarily at more risk, that they still need to do skin to skin, still need to have direct breastfeeding. It's just obviously mother needs to wear a mask, wash her hands, you know, feed the baby, and then maybe take the baby to a different room when they're not being fed. But it is safe to breastfeed during COVID-19 and to also receive the vaccine while you're breastfeeding or while you are pregnant. And you can also still donate breast milk if you have had the vaccine or if you've had COVID. So this is the Coalition of Breastfeeding Advocates for Oklahoma. I think it's Coalition of Oklahoma Breastfeeding Advocates is what it stands for, sorry. Each state is going to have a coalition. So if you move later in life and you still have children, whatever state you live in, they're going to have a breastfeeding advocacy group. But this is ours, lots of information there, mainly kind of like laws that protect breastfeeding families. So if you want more information, check out their website. And then this is some of the laws that they have actually helped pass here in Oklahoma. The breastfeeding, what is this? The break time for nursing mothers, that you have the right to breastfeed during your break times at work. If you are breastfeeding and you get summoned for jury duty, you can submit that you can't go to jury duty because you have a breastfeeding infant, or that you'll need time to pump. And then the newest one of the newest ones is this break time for public school employees. So nurses and public school teachers usually have the hardest time finding time to pump while they are at work, but they have now made it law where it hopefully is going to be easier for those teachers to be able to have time to pump during their day. Okay, so this was so a year ago, almost a year ago, Senate Bill 121 was signed into law, and this is the one that helps I cannot speak today, the school employees to have additional time to pump while they are at work. And that districts need to provide a private, secure room for them to express their milk. It cannot be a bathroom because that would be asking someone to prepare a meal next to a toilet, and that is not allowed. So it needs to be a room that is sanitary and that it is private. So there is a door that shuts, and obviously that they would need access to like a electrical outlet, and then hopefully get a, what is this? OU policy for lactation breaks can be found here. Okay, perfect. And then a refrigerator. So depending on where you are, there may be a refrigerator in the break room that you're asked to use. If you don't feel comfortable with that, which this may be my next slide. I'll talk about that in a minute. You can keep breast milk that you've pumped at work in a cooler, and you can keep it right next to your desk. It will stay safe and fine until you get home to put it in your own refrigerator. Okay, other legislation updates, paid break time, a designated lactation room, and then breastfeeding place, yeah, hygienic places. So yeah, other than a bathroom. So just more work that they've been doing to help protect families, and when they return to work, that they are able to pump. This is the OSCH breastfeeding website. So obviously more resources can be found here. We are a Title V grant with the Department of Health, so we work closely with them, but they have lots of great resources as well. Oh, wrong button. Okay, so this is the milk bank. I know we're on Zoom, but I always ask who's ever heard of the milk bank or knew that we had one or what it was. So we have been around for almost 10 years. Our 10-year anniversary is this summer. And we were the 13th milk bank in the United States. And what milk banks primarily do is that they provide pasteurized human donor milk to NICU babies. So those babies that are critically ill, that need that extra support, that is the primarily reason that they do processed milk. Now, obviously, with the formula shortage that we had and that we still sometimes are dealing with, we got a lot of calls about, well, can I buy the milk? And oh my gosh, why is it so expensive? And I felt like there was a lot of misconceptions that went around in that time frame regarding what donor milk is actually for and why is it so expensive. So all the milk banks that are Habana, which is their governing body, are nonprofit. So these donors do not get paid to donate their milk. So therefore, obviously, if we are selling it to the public, there are a lot of costs that have to be covered. So it can be a little expensive. This is their website, and this is one of our donors here and her little guy. And that is all the milk that she had extra. So she had a healthy baby. She had extra milk that she had pumped, and she was able to generously donate that to be pasteurized. Okay, and then this is our bereavement program that we have. So we have a very small population. If they have an infant loss or a pregnancy loss and they are past 16 weeks, the body will make milk. And so say if you had a pregnancy loss at 20 weeks and you go home and then 3 days later your milk starts to come in, the milk bank can give you information on what to do as far as if you want to suppress or if you want to donate. They're wonderful people to reach out to if you happen to go down be in that situation, and they can help you with whatever you want to do. But this is our tree that represents all of those families that had lost a baby and they were able to donate their milk to further help those NICU babies. Okay, so moving on to more, let me see, a little bit more kind of resources. So if you are expecting or you know someone that is expecting, this is a awesome kind of online, what am I trying to say, pregnancy class. When COVID hit, we noticed that there were no prenatal classes happening anywhere, not at WIC, not at hospitals. So we kind of made one that was accessible virtually. So you can do this on your cell phone or on your computer. It is free. It's maybe 45 minutes long. It's got very basic information like what to do when the baby cries, why do they cry, what are some basic breastfeeding, tips and tricks. So please feel free to look at this with your partner if you are expecting, and it is also in Spanish. So there is that, and it's on our website as well. I think it's on our homepage. And then this is regarding our hotline. So we've had a hotline for 12 years now. We are 100% staffed by International Board Certified Lactation Consultants. So you will get a clinically trained lactation professional that's going to be helping you. There are 8 of us all over the state of Oklahoma. So depending on where you live, we can help get you in touch with resources in that part of the state. It is 24 hours a day. It is free. You do not have to live in Oklahoma to access the hotline. And this is, okay, it's right there. So that is the number to call and also the number to text. And then this is kind of my little interactive. So what do you think is the most common reason that families contact the hotline? And you can plug that into the chat of what you think might be the most common reason. Medications, okay. Medications, breast pain, breast pump questions, or milk supply issues. So it's kind of a trick question. It depends. I would say that medication safety and milk supply are probably the top 2, and they compete. So some months it's medications, other months it's the milk supply issue. 9 times out of 10, when families ask us about a medication, the answer is yes, you can breastfeed. There are luckily very few medications out there that are not compatible with breastfeeding. but we access Dr. Thomas Hale. He runs the Infant Risk Center out of Texas Tech University, and he has dedicated his entire life's work to researching medications during pregnancy and lactation. And that's what the resource that we access to know the safety of medications. So you're going to get some sound information regarding medications. Okay, so this is just, again, the hotline. We won't do like a full demo, but I do like to show kind of what it looks like if you do contact the hotline. So this is, if you text the keyword, this is the first text that you're going to get. There's only, I think, maybe 5 auto-generated text messages. So we don't sit in front of a computer all day long. It is a HIPAA compliant website. So all of your information is safe. And you'll get this. So it's, 1 for Spanish, or 1 for English, 2 for Spanish. We do have it available in Spanish. So let's say you hit 1. We do ask 1 screener question to see if your issue is urgent. So if you have a fever, if you're unable to get the baby to latch, so let's say you say no, that's not why you're contacting us. So we let you know, hey, let us know what's going on. We it may take us 2 to 3 hours to get back to you, and we reply between those hours. And then this is an example: can I take a Benadryl while breastfeeding? If you say that it is urgent, then we give a reminder of, hey, we understand that it's urgent. We may not answer this right away. So we let those families know, hey, if you want someone to get this issue immediately, please go ahead and call the number, and through the voicemail settings, deem that your issue is urgent. That way we can get someone to help you right away. But after that, the next person that you're talking to is a live, real lactation consultant. There's no other auto-generated text messages. So that is that. I think that's just showing it again. Okay, so the Baby Friendly Hospital Initiative, if any of y'all have heard about that, it is something that helps not just the baby, but also the birthing parent as well, to help create the best possible care. So it encourages skin to skin after birth, rooming in after the baby's born, providing adequate knowledge and education regarding feeding, whether that's breastfeeding or if it is formula feeding, how to safely formula feed your baby. And it is a program that was initiated by UNICEF. So this is kind of the rough, data. So 27% of the births that happen in the United States are born at a baby-friendly hospital. So the good thing is that in Oklahoma, we are actually above the national average, which is huge for us, right? Usually Oklahoma is the most unhealthiest state. But we actually have 35% of our births that occur at a baby-friendly hospital. So you kind of see there on the map where our baby-friendly hospitals are located. So we have 5 in the metro area, and then we have 3 in the Tulsa area, and then we have, Comanche County, in Lawton, and then we have Duncan, and then what is number 8? Chickasaw Nation, in Ada. So those are our baby-friendly hospitals. So if you see your hospital that you're going to deliver your baby at there, then you are going to be delivering at a baby-friendly hospital. So that is that list. And then this is Miss Amanda. She's our lactation outpatient consultant with OU Physicians. Like I mentioned before, she's on the 3rd floor of the OU Physicians building next to all the OB offices. So these are her hours. She's in the clinic, and she also does telehealth. She does do telehealth appointments during pregnancy. So if you are currently pregnant and that is something that you are interested in, you can reach out right here and schedule an appointment. But she sees all different types of things, anything regarding lactation. And then these are some other resources for support after you discharge from the hospital. So obviously outpatient at that actual hospital that you delivered at. We have the hotline. If you qualify for the WIC program, they have peer counselors that can help. La Leche League is huge in the metro area. There are some great La Leche League groups around the metro area. Children's First Home Visiting Program. I know there was somebody who was from the Department of Health. So they are an awesome program to actually come to your house and help you. And then the Coalition of Oklahoma Breastfeeding Advocates as well. Okay, so this is what I wanted to spend a little bit more time on. So I'm going back to work. I need a pump. What the heck do I do? How do I get it? There's a bunch of pumps. They all look foreign to me. And you're right. The baby market is ever changing. And I swear they come out with a new breast pump every day. I looked at some last night that I'd never heard of before as far as brands. I'm obviously familiar with different types of pumps. So just kind of want to spend a little bit of time talking about that. If you have questions, please feel free to ask. You can unmute yourself or you can type it in the chat. But this is just kind of an overview of the different types of pumps that are available. So we have manual, which is pretty self-explanatory. You manually have to use the pump with your hand. We have a single electric, so say it's an electric pump that only does one breast at a time. Then you also have a double electric, which electrically is going to pump both breasts at the same time. We have hospital grade. I hope none of you have to use that. That means you don't have a baby in the NICU. But also some work sites offer a hospital grade pump to their employees that they can use. So the difference between a hospital grade and these other pumps is that it is meant to be used by more than one person. So it is a closed system. So no milk enters into the actual mechanism of the pump. It has an extremely durable motor that is meant to last for years and years and years. So it can be used between multiple people versus these other pumps, like this pink one right here. I know you can see what I'm pointing at. It's meant to be used with one person for the duration of one breastfeeding journey. There's the wireless pumps, which you may have seen. They're very popular right now. There are lots of different brands. I'll talk about those in a minute. You may have seen other people use them. They actually go into your bra. They are wireless and they have to have a charge, obviously, and you can wear them while pumping. So you don't have to hold them there. So it's a wearable wireless pump. And then a portable. So it may not be wireless, but maybe it's portable. You don't have to plug it into a wall. Okay, so how do you get a pump? So obviously you can go to Target, Walmart, whatever, and buy a pump right off the shelf, right? If you've ever looked at them, they are expensive. They're about $200 to $400, depending on the pump. Insurance will cover breast pumps. So it just depends on what insurance company that you have. I have here edgepark.com. I'm going to talk about this in just a second. So I'm going to come back to that. You can rent a pump. There are 5 different locations in Oklahoma. This is going to be more for those families that may have a baby in the NICU, if you're wanting to rent a pump. If you have Sooner Care or Medicaid, you would go through your WIC clinic to get your breast pump, and they don't give you a pump until after your baby is born. Do not purchase them online or at JBF or from a friend. The biggest reason for that is that, like I mentioned before, those pumps are only designed to last for one duration, right? So say you have 3 kids, you got a pump with your first child, right? Use it for a year. Got pregnant with your second. Maybe you stayed home, maybe you worked different hours, you used it with the second. Then you have your third and you're using the same pump. Sorry, my phone is on vibrate. You have the same pump, and so you've been using it just like you did with your other kids, and then all of a sudden your supply has gone down and you cannot figure why. You're not doing anything different. And what it is the motor in that pump is going out, and it does not have the same suction, but there's no way to tell. It doesn't sound different. It may not act different. Just the only thing that you notice is that your supply has gone down. So with that being said, don't buy them secondhand. Get a new one with your insurance with each baby that you have. That way you know that you have a pump that the motor is going to do what it's supposed to do. Okay, so this is Edge Park Medical. So we have some OU employees. So you obviously may or may not have, if you insurance with your partner. What else did we have? And someone with DHS. So what I did, this website, it's edgepark.com. You can just Google it. I'm going to put it in here. You can go to this website, plug in where you live, Oklahoma, and then whatever your insurance provider is. So I just did Cigna because I know that's OUHSC's insurance provider. And so it automatically tells me coverage expected. So you can scroll down to see what products are available, right? It is extremely easy. All you do is you create your account. They manage all the stuff. I think at one point you plug in your doctor's name. So they will contact your doctor's office to get the prescription or whatever needed to get your pump. And then they literally deliver it to you. They usually won't do it until I think your 3rd trimester or maybe a month from your expected due date. So you can't do it if like you're 20 weeks pregnant, you want to go ahead and order your pump. You will have to wait and it'll tell you that. But you can see what is available. So let me go to my next slide. I clicked off of this. Where did my mouse go? So this is some examples of what is covered under Cigna, because I just went with that with since HSC employee. So ordering your pump through insurance at any time. Oh, maybe they've changed it during pregnancy. So they work with 1,400 insurance plans. It allows the moms to order the pump through insurance. Choose from your assortments, including a wearable, portable, or any other options, and then they send it to you. So I just put a few on here that are a little bit more of, oh, what am I trying to say? They've been brands that have been around for a very long time, or companies. There's no necessarily one that is better than the other. They just have different options. So you just kind of have to figure out what's best for you. So this one right here is the Medela Pump and Style. Medela is a brand that has been around for years. Most WIC agencies are contracted with Medela, so most WIC participants are going to be using these pumps. This is the most current upgrade. They revamped it in 2021. It's very simple and easy to use, and it's pretty small and portable. So that is a benefit versus like the Spectra, which there's nothing wrong with the Spectra. It can be a little more like there's a lot of buttons and a lot of settings, and I have no idea what I'm doing. Versus the Medela just has on and off and increase or decrease the suction. Moffitt, I've never heard of this company. I need to do my research, but it is another option. Like I said, the Spectra has been around for a while. The Ardo is another one. They're a little bit newer. And then the LV is a wearable pump. So some of you may have heard of the Willow pump. It is similar to the LV. The Willow is more expensive. And most of the time, actually, it wasn't even an option on here. You may, if you really want the Willow, I would call and they may give you like $200 towards the Willow, because I think it's $400 if my memory serves me correct. But the wearable pumps, like you can kind of see here, it looks like a breast, right? And it shows the pump in here. This is the charging port. So obviously it has to be charged to use. The suction is going to be different than say this one, because you're not holding it on you, right? So you have it in your bra and your shirt. You can't see it. So you're not exactly sure if the fit is good. And then it only holds up to 4 ounces, which for some women is fine, not a problem. However, if you tend to pump a little bit more than that, it may overflow. You can't see it. It's in your shirt. Now your shirt's wet. You can't change your clothes. You're at work, just things to think about. However, I will say wearable pumps are fantastic for our nurses or our surgeons, people that are on their feet all day long that don't have time to sit down and pump. They need to be doing something else that they're not sitting in front of, say, a computer, they're walking around. So pros and cons of all pumps, you just have to kind of figure out what is best for you. So those are some examples there. And then a pumping schedule. When do I start pumping? How often do I pump? What do I do? So let's use an example of an 8-week maternity leave in a perfect world, right? Sadly, in this state, some of our mothers are going back to work after 2 weeks. If that is your case, please call me and I will walk you through that. But let's assume that everyone has 8 weeks of maternity leave and you're not having any breastfeeding issues, then you don't need to start pumping, honestly, until 1 to 2 weeks before going back to work. Your baby is going to establish that milk supply for their entire breastfeeding journey by breastfeeding directly in those first 6 to 7 weeks. Say you're going back, like I said, at 8 weeks. So let's say that week before you return to work, I would pump once a day for maybe 5 to 10 minutes. Whatever you get, save it. And then that way, when you do go back to work, you already know you have that little extra in the fridge for whenever you are away from baby. When you feed the baby, when you're with the baby, so say you are back to work and your puppy went away from your baby, when you're with the baby, go ahead and breastfeed directly. So that will help continue to keep your supply where it needs to be, because pumping is not the same as the baby nursing at the breast. It's just a different mechanism. So obviously the baby has their mouth, their tongue, you know, there's the bond. The way that they eat at the breast, it's a push, pull, and a compression, versus the pump is just a push and a pull, right? So to keep that supply going, you do want to try to nurse direct when you're with the baby. And then as far as the schedule, there's several things that go into that, right? It depends on what you do for work. What is your schedule for work? And then if you know, like, okay, I get to work at 8 o'clock in the morning, I'm going to get up at 6. So get up at 6, feed your baby directly from the breast, go to work at 8, maybe at 10, pump, maybe at noon on your lunch break, pump, and then maybe say at 2 or 3, pump, and then say you're home by 5, then feed the baby when you get home. So then you're only pumping 3 times in that day, and the rest of the time that you're with the baby, you're feeding directly. It just kind of depends. So that's just kind of an example. And like I said, when you're away from baby, pump every 2 to 3 hours, depending on the age of the baby and what your schedule is. So what I say, depending on the age, I do have, you know, families that I've helped in the past that went back to work at 6 weeks, and they worked for, you know, somewhere where you were like, wow, you only get 6 weeks maternity leave. So at 6 weeks, baby usually goes through a growth spurt naturally, right? So she was away from her baby during that growth spurt time. Luckily, she was able to pump a lot at work, but she did have to pump more frequently than every 2 to 3 hours during that time, knowing that her baby was in that growth spurt, to just kind of mimic what the baby would have been doing if they were together. So if you need help with this, depending on your situation, reach out to the hotline, or you can schedule an appointment with Amanda and we can help walk you through your situation. Okay, how long to pump? We get this question a lot. Please don't pump for 30 minutes. Don't do it. It's exhausting. And you're really not getting any more milk than if you pump for 10 to 15 minutes. If you've got a busy day and you know you're not going to have a break to pump, and you just think, oh, well, I'll just pump for 30 minutes when I get that time, it's actually better to have a manual pump with you and pump for maybe 2 to 3 minutes with that manual pump, get that milk release, and then sit down with your electric pump when you have the time and pump for 10 to 15 minutes. Because when you start stretching out those huge blocks of time, your milk supply can be impacted and you may get really full and uncomfortable. So yeah, best to pump more often for shorter bursts of time versus for pumping for long periods of time every 4 hours. So yeah, 10 to 15 minutes is about all you would need, maybe 20, but 30 minutes, you're really not doing yourself any favors. Being said, that is completely different than, say, if the baby was at the breast for 30 minutes. The baby's different than the pump. So they do like non-nutritive sucking, or they may nurse for a long time, fall asleep at the breast, and then wake back up and nurse and fall asleep. So it's different than a baby at the breast for 30 minutes than if you were pumping for 30 minutes. And then as far as how long, like age-wise to pump, that is completely up to you and your baby. The American Academy of Pediatrics and the World Health Organization recommend as long as mutually desired. So if you know anything about how babies age, right, they don't eat as much, or they don't nurse as much at 1 as they do when they're newborn, right? So say you're breastfeeding for 2 years, but once you hit that 1 year, 15-month mark, you may not need a pump when you are away from your baby, because the baby may only be nursing 1 or 2 times a day. And you could do that when you're together. So you wouldn't have to necessarily pump when you're away from baby, but each situation is different. Okay, so kind of more of that. When should I pump? When your breasts feel full, and then pump during the times that you would normally feed your baby. Where should you pump? So a sanitary, secure location available near you. So it could be an office, or if your facility has a lactation or mother's nursing room. This is a great picture of one that is at the Tulsa Zoo. There are many all over. I mean, I know like I think the Oklahoma City Zoo may have one. I was just there, I should know this. I know that the Science Museum has one. Most places nowadays have gotten much more progressive in acknowledging that families need this service. I know like the State Fair, for example, they have nursing rooms available. Oh, has theirs in the front entrance. Awesome. OKC Zoo does. Even like the Dodgers ballpark in downtown Oklahoma City, they have a nursing room. So just to ask is kind of my, 2 cents. Wherever you're somewhere and you need to nurse or pump, just ask somebody and they direct you where to go. Most airports have them as well, which is awesome. Okay, so where to store your pumped milk. So your office refrigerator, or if you have a mini fridge in your office. Also, is this the next slide? Hold on. Yeah, I'll come back to this other one. If you don't have access to a mini fridge, or maybe you don't feel comfortable sticking your precious milk in the fridge where everybody gets their lunch, that is totally fine. You can get a cooler, like a little lunch box, and have the little, ice packs you can get on Amazon or whatever, have 2 or 3 in there, and that milk will stay fine until you get home to put it in your fridge. So you can just keep it with you. Sometimes, depending on where you work, that I've seen families do that for lots of reasons. Maybe it's ease. Maybe you travel for work and you're pumping in your car. Same thing. But this is the guidelines for breast milk. So freshly pumped milk up to 4 hours. So that's like room temperature. This is old. This is from 2018. They have actually extended this. So if you are at your house and you keep your air at about 70, 72, and you pump in the middle of the night and you fall asleep and forget all about it and you wake up hours later, do not throw that milk away. It is fine. It is safe. Put it in the fridge, feed it to baby, whatever the case is. At room temperature is honestly good for up to 6 hours. In the refrigerator, once it is pumped, it's good for, what is a countertop fridge? Freezer with a door. Within, so what am I store? Oh, those are the temperatures. I can't read. A week. I don't know where it says that. 1 to 2 hours up to a day. That's thawed. Man, I really need to update this slide. If you pump it, it is fresh. You put it in the fridge, it's good for a week. If you freeze it, it's good for 6 months in the freezer, like the refrigerator. If you have a deep freeze, it's good for up to 12 months. Once you thaw the milk, you want to use it within 24 hours. So what I always tell families is, say your baby's in daycare, send all the milk frozen. Don't thaw it out ahead of time because your baby may not use all of that and they can thaw it there. So just keep it all frozen, send it in a freezer pack and it'll stay frozen and then they can thaw it as they need. If you've seen those little milk storage bags at the store, they lay flat. They're kind of thin and long. So you store them like this. So when you're thawing them, you can just stick it in a cup of warm water, like a Yeti. So it's insulated, and just put it in warm water, let it thaw, and then you can give it to baby. Another thing, temperature is completely baby's preference. There is absolutely nothing wrong with giving your baby cold milk. If you can do that in the early stages, you have saved yourself a lot of trouble. So there's a lot of those questions like, does it need to be warm? Do I need a milk warmer? It's completely preference. There is no nutritional difference for the breast milk at any temperature. Okay, it's all baby's preference. So if you can get your baby to take cold breast milk, you've saved yourself a lot of headache over the years. But yeah, you can thaw it out, give it to baby. I think let me go back to this page. Okay, so this is, if you are an OUHSC employee, I don't know if we have anybody on, but these are all the pumping spaces. I know this map is kind of poof. Ask your supervisor. If they don't know, we'll find it. We'll figure it out. I know that Kaylee knows a lot of them. She's a rock star as far as that's concerned. But OU is a great system. You do work for a good place. They are going to be supportive. If they aren't, let us know. We'll fight that fight for you. But they, are going to have more places than others. I know where was I at? Nicholson the other day for a conference. Beautiful lactation room. So that was fun to see kind of different places on campus with the different rooms. And then this link has, if you are HSC, the lactation room list, if you want to look at that. Okay. And then a little bit more on the laws, just one more time. Can't stress this enough. You have the legal right to breastfeed wherever you are. I don't think I said that earlier. If you are not trespassing, you can breastfeed wherever you are. As most of you may know, usually when you're breastfeeding, you can't see anything. If you want to cover up, go for it. It's completely your preference. It's whatever is most comfortable for you, but no one can legally tell you to leave a space if you are breastfeeding. Oklahoma laws protects rights for both the baby and for the mother. State employees and public school employees have rights as well. And then the national law encourages all employers to allow pumping breaks. So that's just kind of a recap there. The Affordable Care Act, Fair Labor Standards Act states that reasonable break time for an employee to express breast milk for her nursing child for 1 year after the child's birth, each time such employee has the need to express milk. So as many times as the mother needs to express her milk, she should be allowed to do so. And it should be in a place other than a bathroom that is shielded from view and free from intrusion of coworkers and the public, which may be used by an employee to express their milk. So yeah, please don't pump in a bathroom. Breastfeeding in Oklahoma businesses. So if you know a business or employer that is breastfeeding friendly, we do have a program for that, where we recognize these employers and they do get awarded. There's different levels they can apply for that. It's through OSDH. They have a spot on their website. We'd love to recognize them and support them in their support for their employees. Let's see. And then any questions? I know this is a smaller group. Hopefully y'all learned something you didn't know before. So.
While you might be thinking of some questions, I will go ahead and just do a reminder that this is recorded. I'll follow up with the link once it's ready, along with the links discussed today with the websites, and for OU employees, the links to our HR page with the policy, as well as the different lactation rooms available on each campus.
So yes, always, yeah, thank you for first-time moms, absolutely. I encourage you to do that little, what do you know about breastfeeding prenatal kind of education, do it with your partner. Great information there, and it's all just kind of basic baby knowledge, if you will, for first-time families. And then, I love this question, and I always wish I knew I had a better answer. So recommendations for what to do with a pump that didn't work for you and you barely used it. So if it was barely used and you still have it, fortunately, you can't like sell it or give it to the milk bank since it has been used. But what you can do is, if you do have a close family member or like a friend, and obviously it's safe, right? You know, like say your best friend or your sister or something, you could absolutely give it to them. But you wouldn't want to like sell it just, I mean, not that you're not safe, but you know, you don't want to like sell it on a marketplace situation. But yeah, it's still good, like you said, and you could just, yeah, give it to someone else. So if you ever happen to have a pump that never was used and is still like in the packaging and whatnot, the milk bank does take those, and we give them to, if we ever have like a bereaved donor that maybe can't get a pump for whatever reason, we try to, we've given those over the years. I've had same thing. I had a friend who had a pump that they never used. It was still in the box that came from her insurance. And so I gave it to the milk bank in that event, that if they had a bereaved donor that needed to get a pump, we could give it to them. So, but great question. I wish there was like a recycling pump program or something, but we haven't gotten there yet. So, are the hands-free pumps less powerful than double pumps with the plug-in? Great question. It just depends on the person. Okay. Now, yes, their suction is different because you have to remember it's charged, right, from like a UBS cord. I have been told that the Willow is the strongest, the super expensive one that wasn't even showing up in my list as far as suction is concerned. But I've heard great things about the LB. So it just depends. But I would say, yes, one that plugs in is going to be more powerful, but is it that much more powerful that where the LV doesn't work? I wouldn't say that. I would say maybe like it's just slightly more powerful, right? Like there's still going to be a good pump. If you do happen to get a wearable pump like the LV or whatever brand, I would also encourage you to get like a manual, which I showed, there's lots of different versions out there. I don't know what I had a picture of. This manual, this purple guy. Medela makes one called the Harmony, which is the most popular, and you can always usually find it at Target or Walmart. I would keep that with you just because in the event that maybe it didn't, I don't know, didn't empty the breast or whatever, you have this other option that's super quick and easy to use. But manual pumps, especially for the working mom, are always great to have with you in your pump bag in addition to a double electric. So if you're on Instagram, we got lots of stuff. Took my manual everywhere. Absolutely. Road trips, you're exactly right. Manual pumps, I feel like the most underrated thing for breastfeeding families. Put it on your registry if you were expecting and make sure someone buys it, because I mean, they're not that expensive, but yes, manual pumps are fantastic. Okay, the Be My Breast Friend does all sorts of pump reviews that are concise and to the point if you're overwhelmed when trying to choose one. Yes, absolutely. Yeah, do some research. Like I said, you know what your situation is going to be as far as your work situation of what your schedule's like. So, oh, I got mastitis. Does a massager help with that if I feel a clog? Okay, great question. Mastitis can be caused by all kinds of things, and sometimes we don't know the cause, which is probably not what you wanted to hear. But yes, frequently emptying the breast is definitely key. So you can use the massagers with the clogged duct. However, the most current research that they've been showing is that when you actually have mastitis, that massaging can sometimes cause more damage to the breast tissue. So maybe if you feel a clog coming and you're not full-blown in mastitis, then yes, you want to massage. You can do that while the baby's nursing. You can do the massage, and say if you feel very full and you feed the baby, you still feel full, don't go pump for 10 minutes. Okay, that will just continue the cycle of the overproducing and the clogged ducts and all that stuff. What you want to do is maybe just like pump for a second or even hand express for like a minute or whatever, just to get the milk to release, but not enough to tell the breast that it's empty and produce more milk. So it can be hard to navigate. And if I'm assuming you are expecting again, this is obviously maybe your second or your third baby. If you know anything about the human body, the more children we have, the more milk that our body can make. So we obviously don't want this mom to get mastitis again, right? So you just kind of have to do some kind of, experimenting in those first couple weeks to kind of get your supply kind of where it needs, and avoid any tight clothes. I can't express that enough. Do not wear tight bras or tight tank tops, or say if you're wearing the baby like all day long and maybe your baby wearer is too tight and baby is like sitting obviously right here on your chest. I've had cases where people have contacted the hotline where they got mastitis from wearing their baby all day long, which what do you do, right? She had a toddler. So just kind of be aware of that. Just try to avoid tight things. Also, if you leak a lot, try to keep your breast as dry as possible, whatever that looks like, whether it's different types of nursing pads or collection. They make little collection things where if you drip a lot, you can find them on Amazon, and you just stick it in your bra and it will collect the milk that you leak out, and then you can save it, and then it can help to prevent that extra moisture being in your bra as well. So great questions. So yeah, hopefully, and if you have any issues, please reach out to the hotline, reach out to Amanda, we'll help you. So anything